The operating theaters are not functioning. They're not functioning for emergency surgeries, but also they're not functioning for women in need of C-sections, for example. We're getting ready for what seems will be a long and intense emergency. We've seen that the health system has been affected and is hampered at many levels, but one particularly concerned is the secondary level of care. These are the hospitals. So MSF teams will now focus to already palliate and bring immediate relief for offering secondary healthcare services. At the same time, we cannot leave aside how important primary healthcare services are in this context, and this includes access to medication so that the patients with diabetes, with hypertension can continue their care. We are very worried for the affected population displaying symptoms of stress and acute trauma after the horrible experience lived during and after the earthquake and the aftershocks that followed. So the MSF teams have been closely working to deploy trainings for psychological first aid. It's always a complement that is required for emergency response in such a context. The key element for us to respond to the emergency in Myanmar is community engagement, is working hand in hand with the existing efforts by the community. It's the only way in which we can make a meaningful difference and a meaningful impact in the health and well-being of the affected population.